I just couldn't get my microphone back on. I don't know what happened.
Good morning, everyone. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Comrade Cancer Foundation, in partnership with AIT. It's nice to have you back on again. And today we'll be talking about misconceptions on do's and don'ts, the supporter's voice. As you would observe, this year we've really spent a lot of time trying to talk about the experiences of cancer patients and their families. Firstly, though, I would like to really appreciate, and that's on behalf of all of us in the cancer space, appreciate the chairman of DAR Communications for making this program a reality. We came on air in October 2021, and we have run this program since then bi-monthly. We can only say thank you to God Almighty and thank you to DAR Communications for agreeing to champion our cause. Mr. Shola, we want to thank you as well and your team for always supporting us and guiding us through this thing. You know, I'm not a presenter. So today, what are we talking about? Today, we'll be talking about a cancer champion who has survived breast cancer as we create Breast Cancer Month awareness. This is who is in the house with me today. We've got Mrs. Abigail Simon Hart. Hello, Abigail.
Hi, Denise. How are you doing? Thank you for inviting me. It's such a privilege to be here, honestly.
Thank you.
Absolutely fantastic.
Thank you for agreeing. You know, this is Breast Cancer Month, so we've got to do things right. Together we fight, together we win. Common Cancer Foundation, that's what we believe in. Together we will make a difference. And so we're making a difference. According to Agodiran Olayide et al., that's how I would put it, in 2023, he said Nigeria has one of the highest age standardized breast cancer mortality rates globally and the highest in Africa. Late presentations and diagnosis have been studied extensively as causes of high breast cancer morbidity and mortality, while treatment and outcomes are underreported. With inaccurate data, how do we plan to reduce mortality rates in Nigeria? That is a very big question that most of us, cancer patients and survivors, are asking. And we hope that one day we will get an answer to this. So in this today, let's talk about what we're talking about. We're speaking to Mrs. Abigail Simon Hart. Abigail is a breast cancer survivor, counselor, and patient advocate. She co-founded the Brecon Foundation in 2016 and Centerport Medical, a multi-specialist hospital in Bagada, Lagos, with an oncology unit and palliative care ward in 2020. She's passionate about empowering patients to find their voice and promoting health body image in women who have had a mastectomy. Please. Having had a double, herself. Let's go. Because, I like to crack my joke. If I can't pronounce it, I can't pronounce it. Life is not that deep.
It's not.
Through her work, over 7 years, 300 patients have had financial support for treatment and related costs. 450 women have benefited from free mastectomy bras and breast. Madam, what's this?
And silicone, so breast prosthesis, artificial breast, basically.
Thank you. And more than 400 doctors, nurses, and care workers have been training in cancer awareness, end of life, and palliation. She is an avid promoter of the rights of every patient to quality of life and dignity in death. Welcome everyone once again to Kakaki Cancer Awareness. This morning, we will be sitting down to have a real discussion on the experiences that are going on in our cancer space. So, this is Breast Cancer Awareness Month. And this is another year, and the question we're asking is, how far have we gone? Where are we? And what can we do best? So as I start this conversation, it's good to understand the person that is going to be speaking and will be interviewing today. You are very involved, Abigail, in training medical professionals on the lived experiences of patients. And this is a very big issue because a lot of people don't understand or assume or think this is the best way and forget that we are as human as the next person. So please, let me start with you sharing your story of this journey, because it's very similar to mine.
Okay, so basically I grew up with a mother who had cancer 4 times. So my cancer experience started as a family member of somebody who had cancer. You know, back in those days, cancer wasn't gently like now. The drugs were harsh. It was it was the side effects and things were terrible. So my mother survived cancer 4 times after they said she was going to die. And then she lived for 33 years after the last one. Then she got cancer on the 5th time as a side effect to a medication she was on. And she died within 6 weeks. And she died in a hospice in Australia. And what really shocked me was that there's such a thing as a good death. We were involved in the process. They took us through, and so it wasn't alarming because we understood what was going on. They carried us along. After losing my mother, 6 months later, I was diagnosed with breast cancer myself. And my diagnosis was on a gut feel. I was very breast aware because my mother had breast cancer. So I'd go every year for screening and things like that. And this particular time, they told me my results were okay, but my gut was telling me it was not. My spirit was disturbing me. So I traveled abroad since I had medical insurance, and I had a mammogram and ultrasound again, and they discovered I had cancer. And so I had a double mastectomy. It all happened very fast because of my mother had cancer. Remember, my mother had cancer. I was so aware and so knowledgeable about the disease that I read everything there was to read. When I came back to Nigeria, I discovered that the situation here was horrible. Patients were dying, patients were scared, there was so much stigma. So in 2016, we decided to set up the foundation to try and educate, to try and support in terms of funding, to get involved in some sort of training. And in 2017, we approached Macmillan Cancer Support UK. They're one of the oldest cancer NGOs in the UK, and they specialize in information, printing documents, and training. And so we decided to partner with them to create training relevant to Nigeria based on patient experiences in terms of end-of-life palliation. How does it feel from the other side? We did this building of training together with palliative nurses of Macmillan. What does that mean? We looked at it from the carer point of view, the people who are counseling the patients who are dying, from the family point of view of what does it feel like when you're being given that diagnosis? What does it feel like when somebody you love is being given that diagnosis? So we could come across with a more holistic arrangements. We brought in experiences of patients. We brought in experiences of loved ones. We brought in experience of the doctors and nurses because everybody suffers during a cancer diagnosis. It's not just the patients. You know what I'm saying? So we've come up with a very holistic training that really brings it down to how do you deal with it, your own mortality? How do you deal with a patient's mortality? How do you get the patient's voice heard and things like that? So it's a that's what really, really, really got me into the training was I realized that we have to make a difference by getting people empowered. The patients empowered, the doctors empowered, the nurses empowered, and together we can actually make a difference in this cancer space. So that's how the whole training thing came about. Because there was need to bring our own experiences as cancer survivors, as those dealing with people who are dying to the fore, so that we can actually speak about things that are tangible and concrete and not just beat around the bush. We need patients to actually be involved in building trainings. Otherwise, you'll never get it right. They're off points.
Thank you very much. I'm very glad we started the conversation from this perspective because you said you've been involved in training and stuff, and that helps because it will be important for us to now start getting the relevant voices to maybe look at whatever you've done with Macmillan for the Nigerian space and see how widely spread it is and maybe start seeing how to work together. But then that's what we're all here together to. We're together to fight, together we win. That's what the purpose is. So the next question says, as a survivor, you will acknowledge that there are a lot of misconceptions on the lived experience of a cancer patient. Lots of patients will not take chemo, which has thrown me, I couldn't believe it, and opt for alternative medicines. I do not say alternative medicines are not right. Everybody has a right to make their own decisions, irrespective of whether we agree with them. with no bias involved, what is your advice or what are your thoughts on this particular issue with these misconceptions? Okay. And why did you come up with that? Why did you say that?
Okay, I think one of the issues here is that it's fear and misinformation. A lot of cases of cancer are late presentation. And there's a difference between how you react to treatments when you come late and when you come on time. And as long as we don't have cancer survivors who are getting treated and getting cured or being able to live with the disease, people are going to continue to run away from chemotherapy because they believe it's the chemotherapy that kills. If you turn up on time, if you go to the appropriate medical provider to get care, your outcomes are much better. So it's not a matter of chemo kills. It's number one, what stage were you? Was your chemo appropriate? Did you go for the relevant tests? Were you treated by the appropriate medical personnel? Those are all the things that affect outcomes of your treatment if it is chemotherapy. So I think we need to really get that right, that chemotherapy does not kill. It is your body's response depending on when you turn up for that chemotherapy and if that chemotherapy is relevant or not. Do you get what I'm saying?
Yeah.
And that's the challenge. That's the challenge that you have. So we're back on the issue of survivors need to talk. You know, some of us keep coming out. We're the same us coming out. People are saying, well, we know Denise survived. Abigail will survive. Where are all the other survivors that are surviving? So we need people to come out and say, look, I went through treatment. I'm alive. Look at what I look like. We don't look like we have cancer. Do you know times, we've had cancer. We don't look like our disease. And that is the point here. On the subject of alternative medicine, I personally I'm yet to meet one person that has gone alternative and survived. Personally, there's a difference between going for alternative medication when all hope is lost. Then at that point in time, you can try anything because you already know all hope is lost and whatever may work. You know what I'm saying? And we must not confuse alternative medication with complementary treatment. Some people will do yoga, do acupuncture in addition to their chemotherapy and treatment. So we shouldn't mix things up. Then the other thing is, I almost want to put faith healing under alternatives because the amount of people that will go to church only after getting a diagnosis and not to a hospital and then come rolling in when the cancer has already spread are plenty. I believe faith is crucial in the cancer battle. I know that without my faith, I wouldn't have got through it. However, we need to understand that there's nothing wrong with combining faith, using your faith, and then medication. Because at the end of the day, it has to be a holistic approach. You cannot say, okay, faith is not important, only medical treatment is possible, but important. It has to be done holistically. So my own is that, look, if you want to go to church for prayers and go, by all means go, but do not substitute prayer for going to the hospital. Even if you believe you are healed, I say, God beg you, go back to the hospital that told you had cancer, redo all your scans, and now show evidence. I mean, even in the Bible, it says they searched the scriptures to see what. So when Jesus was even there. So go back to that same hospital that told you had cancer. Show them, let them redo all the tests and prove that you're cancer-free. There's nothing wrong with that. Then you can use that one as your own testimony. The amount of times that people, in our foundation, we've had patients run away to go and do faith stuff. And then they come back when it's stage 3, stage 4. And then they wonder why the chemotherapy is not working, why the reactions are so bad. We also have to remember that for chemotherapy and treatment, there is medications to counter side effects. The side effects are not as bad anymore because medical science has advanced. So chemotherapy in itself is not a bad thing when it is managed properly, and it can be used even to maintain disease. It can be used to stop the disease from spreading. So I'm really an advocate for, please go to the appropriate place who can give you the correct chemotherapy. The amount of people that start chemotherapy without doing tests, they'll go to a normal hospital and start running chemotherapy and they wonder why it's not working. Meanwhile, they've done no test to check if the chemotherapy is the right one. The amount of patients that have come to the foundation who have gone and done chemotherapy in some hospital somewhere. And by the time we do the test, the chemotherapy was the wrong chemotherapy. They've used all their money on the wrong thing. By the time you now want to give right chemotherapy, their body is too weak to even accept it. So we need to really be empowered to look for the right places to attend. There's lots of support groups who can give you information. Be informed. Read about side effects. Read. I'm sure you read every book there was to read when it came out. It's knowledge. I mean, my people perish for lack of knowledge. We need to be educated as people who have had cancer and have cancer. We need to read. Don't let anybody hold your destiny, I beg. You must empower yourself to know it's your body. It's your body.
Thank you. I actually find it very interesting because at the end of the day, a lot of the time, people will see people like me come out and think it's easy to come out and talk about this disease. They don't realize the challenges or the realities. But honestly, cancer is not on any of us face. I still take chemo every day. So I'm still laughing. Let's look at the next one. What would you like patients to be aware of? Focusing, I want you to focus on a particular thing, focusing on the implications and benefits of this treatment. Focus on that specifically, especially pain. I learned in the last 3 months, 4 months, what pain was. I have been going through this thing for 7 years and I'd never understood pain. Your body's paining you, everything's paining you, we all think that's pain. I saw pain that I saw on a scale of 1 to 10, 9, 10, and I didn't get it. I had to ask a question. If this is what pain is and it's not the cancer, what am I fighting for? So I'm asking you the question from that perspective. Because patients go through this. Now I'm good, but I really had to find myself. And I want you to speak to that.
Okay, I think that we're back on the issue of accessing the appropriate treatment. Because there's a lot of times, like I said, we're back on the issue of going to the right place and then speaking out. Sometimes patients are too scared to ask questions. When the medication is not working, they're too scared to come out and say, well, the thing is not working. Because I don't know, we have to get to a point whereby doctors, I know that the doctors are overworked and overwhelmed, so sometimes they don't have so much time, but it boils down to being able to talk about how you're feeling, expressing yourself. We seem to have this, I don't know, I think maybe it's changing now, but a lot of times patients see the doctors up there and they're not allowed to challenge things. They're not allowed to say what is going on because maybe it looks like they're reporting or the doctor doesn't know what they're doing. Medicine is not an exact science. Just because something worked for somebody else does not mean it's working for you. Sometimes the thing needs to be upped. Sometimes it needs to be reduced. Sometimes you need to combine. So if the patient is not talking, if the patient sits down and says, well, cancer is supposed to be painful because that person had pain, a lot of times we're busy comparing ourselves and listening to other people's stories instead of making it about us. So I think as people who have cancer or have been through cancer, we have to be able to say, this is what is paining me. When the doctor says something, when he says, okay, look, but the medication is supposed to be working, have the courage to say, I'm sorry, the thing is not working. I think we're back to this empowerment of the patients to say exactly what is going on. And don't be afraid to switch. Don't be afraid to change doctor, change hospital. If you need third opinion, I beg, go for third opinion. Because as long as we're lying down and just allowing people to dictate where we go, how we go, what we go, do you know what I'm saying? Some people find that in their pain, swimming takes the weight off their joints. And that hour that they're in the pool helps them feel less pain. Do you know what I'm saying? It isn't always the conventional way you have to go. I remember we were chatting the other day and you were saying it was Gary that stopped your diarrhea. I think we need to move away from sometimes think outside the box. And that's why conversations like we're having now are crucial because there's nobody has monopoly of knowledge. Even if I remember our black cancers are not behaving the same as white cancers. We know that in black women it is earlier. It is more aggressive. In black men, same thing. So shouldn't we be sitting and thinking, okay, this is what the books are saying. Why can't we be now compiling our own things of what works for us? We need to start thinking for ourselves in Africa and in Nigeria. We really need to. As patients, we need to sit down and say, okay, look, why don't we sit down and start having discussions about what works? Why don't we start putting us and getting us involved on boards and policies where we can speak of our own experiences and start changing things? As long as non-cancer survivors and non-cancer patients are making decisions concerning our pain, our welfare and co, we're going to continue to be rolling around and not making progress. It's really about us speaking out about where our toe is paining us, how it's paining. The doctor tells you, it is supposed to be working. Doc, it is not working. We need to find something else. We need to try something else.
I learned that. I learned that. I couldn't believe that. I could be so much pain. I couldn't walk. I said, what is this? Where did this come from? I have all this fighting 7 years. Is it from here? Nah. Just leg, my bones will now pain me, and that's it. I will just die from that. No. I started to make noise. I think I have 6 different consultants now trying to work out where the thing came from. But that's because I've not fought a battle for somebody to take me down. Okay, so let's look at another one. I mean, you are into these NGO things, and you have an NGO, and you're very widely into how to help people. So I'm going to ask you a question, but in the same question, I need you to help me with something. So as an NGO, you have sponsored patients on everyday needs, and that's one thing that is very important in looking at how to help cancer patients, because no one single government can help cancer patients. We have to accept that. It's humanity, it's NGOs, it's people, it's volunteers, it's philanthropists and all that. So the financial burden on patients is at an all-time high. My question would be, what next?
My sister.
It's hard because I'm not going to say this. You see, the financial burden of cancer patients is a global thing. So I'm not saying it's a Nigerian thing. It's a global thing. And because it's a global thing, we have to narrow it down to our needs as Nigerians in Nigeria with the issues going on. So just summarize this for me. Let's just touch on it because it's important.
Well, I think that the reality on ground is that we all know out-of-pocket for patients is not sustainable. And even at the point, even if we have handouts again doesn't solve the problem because it's not sustainable. We need, there's this cancer health fund, and it's quite a lot of.
What's a new name, by the way?
Is a new name? What's the new name now?
Don't ask me. I don't know.
So the challenge with that kind of thing is that the amount of hoops you have to jump. I'm yet to meet anybody who has benefited from it personally. I have not met anybody. And that's not to say that people don't. But we're back on the issue that there's no records of anything. We don't know how many people have access. But let's leave that conversation first. I think the issue here is that we need to get it included, as in cancer, whether you're palliative or treatment, into a health insurance scheme. So that ultimately it's being, it's your contributions and things goes towards it. Because even in England and the so-called developed world, there's contributions from taxes and code that enable people to be able to access. There's no quick fix. We can't keep saying, just give somebody 2 million, just give people. It's not sustainable. We need something that is everybody's contributing towards it, that is accountable, and it actually translates to people benefiting. Because that's always my worry with any kind of funding, is how do we know that the monies are being used for what they're supposed to be used for? Where are the records of people who have been helped by these things? And these are things that should come out as public knowledge, because if we are accountable as a people, you'll get international governments ready to help now. You'll get individuals ready to drop money. So we're back to the issue of anything that we're doing. Let's start getting some numbers and some statistics. How many people have benefited from? I know that they're trying to put, I think they put some elements of cancer on the NHIS, but we need to increase the coverage, because foundations like ours and other people who are the private sector helping, it's not enough. It has to be on the national level. It has to be sustainable. It has to be accountable. Because as you show transparency, more people are likely to give support. That's what it boils down to. I don't know if I'll answer the question properly.
Yes, you have.
It's not a straightforward, it's not really a simple question, answer to that question.
I didn't expect it.
Complicated. Yeah.
I didn't expect that. You see, one of the things you have to remember is I try to make a point of getting understanding so that it's not about attacking the professionals or the organizations or whatever.
Exactly.
It's about, let's say, these are things that are issues. These are things that need to be addressed. These are things that there are other alternatives. And I'll give an instance. In the UK, a lot of cancer patients will access people like the same Macmillan you just asked, who send us cancer patients funds. They do send. Yeah. So it helps you to see that at least they will send money once in maybe 3 years, 5 years, or whatever, to help a cancer patient, because the cost of everything is high and it's not going to go down for as long as you are actually taking treatment. Okay. The International Cancer Week is coming up in Nigeria very soon. How involved or engaged are you guys? Are you all getting ready for this? I'm hoping to be there, but how are you guys looking forward to the event? Because I'm going to talk to them next.
Okay, I mean, I think personally, I'm really interested because this is my very first time of going to International Cancer Week. I've always been out of the country or engaged somewhere else, so it's quite important for me. I had a look at the program. I don't really see anything that is patient advocate related. I don't know, maybe you saw, but I didn't see anything like that. And so I'm looking forward to being there because I think that it's really important that we as cancer survivors have a seat on that proverbial table. You know, I'm not sure that it's always a good idea to have a separate table. We all need to be on that same table so that when policies and things are coming out, they're getting the patient point of view. It's absolutely crucial that we are included in policy making, we're included in treatment protocols, we're included in rollouts of plans, strategic plans, and things like that. But who better to guide for appropriate treatment and appropriate way to go than the people who have navigated the journey very often on our own. You know what I'm saying? Yeah. I wasn't navigated through the system. I had to find my way. And I'm sure the same thing for you, through our foundation, we've been able to compile and understand the shortfalls of some of the different things to be able to come up with a better way to navigate through it. So I'm looking forward to it because I think it gives an opportunity for us to find a way to bring to light the importance of our role in making cancer a thing of the past or under control in Nigeria. So, I mean, I think it's going to be really good. You know, some of us will wrestle we'll wrestle our way onto that table. If there's no space, we bring our own chair.
I think we're many of us. I think a lot of us now are doing our fundraising because most cancer patients are permanently fundraising. So I think all of us are now fundraising to make sure we can get to the table this year.
That's it.
I've sent all my messages to all my donors. I said, "Excuse me, please, I need my ticket to Abuja." Okay, so
we're rustling up our money for our tickets.
Like you have said, you are also looking for yours. It's very important. We have to sit at this table to make a difference, and we're really trying to get there this year. So. Yeah. ICW, please watch out the space. We are actually trying to get out there and we are coming out there this year because we need to hear, our voices need to be heard.
Exactly.
Now, so that the Nigerian population know, and it's in Lagos mainly, BRACON, which is your organization, is sponsoring 5 people in the Lagos area. Can I be clear? To a dinner for cancer patients, survivors, male, female. It's not about just female. This year. So firstly, since we were given these tickets, we are giving it out to anybody in the Lagos area watching us today. The first 5 people in the Lagos area that sends us a DM to Common Cancer Foundation .ng, just go onto our Instagram page and put out your name there, and we will get you a ticket to dinner. Makeup, everything. Please, can you explain it quickly so that our people can enjoy this thing? Because you know.
So what we're doing is that thanks to Movenpick Hotel, we're having a cancer survivor fun day. There will be free professional photography. There'll be makeup. There'll be games. There'll be fun. There'll be food, and it's like a day thing. It starts around 10 for the makeup and photo shoot. It finishes around 6. And it's just a day to have fun and exchange. And, you know, you'll meet people who are stage 4. You'll meet people who are newly diagnosed. There's male, there's female, there's breast. So we're not even discriminating in the stage, the cancer, the male, female. And it's just a time for fun. You know, I think it's so many people just need that encouragement. By the time you see somebody who is a 40-year cancer survivor and you're just joining the bandwagon, you can say, me too, I can be like that. And the makeup makes people feel good. You know, when you've had a professional makeup and you're taking photographs and feeling very cool with yourself, it's such an amazing day out. So we're really, really looking forward to it. And we're looking forward to seeing the 5 people that are going to the 5 lucky people that will join us from you guys.
Yes, we are looking forward to that. So I want to thank all you viewers. You see, there's whatever is going on. Please watch the space across Nigeria. A lot is going on in this breast cancer awareness month. So if you can get involved, be part of it. Together we fight, together we win. You can follow us on any of our social media pages, Common Cancer Foundation. click on the share button. Make sure you get out the videos, get out the messages, because we can't do it without you. Instagram, everything. And also remember, follow the Bricom Foundation, because they are the ones giving out this thing, and a shade of pink foundation. You should be able to see, get information, no matter what it is, anywhere. You can get something. You'll be so surprised. We always need help. Together we fight, together we win. I want to thank you all. This is Breast Cancer Survivors, Breast Cancer Awareness Month. So our next program is going to be ICW. I'm going to have to go and find who's going to talk to us. So we'll be talking to you then next time. Have a lovely, lovely week, and thank you for joining us. Thank you, Abigail, for being with us today.
Thank you so much, Denise, for inviting me. Thank you. And well done on all the amazing work you're doing. Take care.
Thank you, everyone. Thank you, AIT. Take care.
Take care. Bye.
Please watch the space across Nigeria. A lot is going on in this Breast Cancer Awareness Month. So if you can, get involved, be